In 2010, a tragedy on the campus of a state-run hospital in California sparked exceptional public-private collaboration in building a unique personal duress alarm system that many think is a game-changer in safety technology. At first glance, this 420-acre campus located in the picturesque landscape of Napa, California, looks more like a private community than a hospital for patients with serious mental illness.
It's not the typical hospital environment based on our patient population, the layout of our campus, and the variety of complexity of services that we provide. The primary driver for providing greater campus security at Napa was a very personal and very tragic event, which was the homicide of one of our staff while on duty. She was in an open portion of the campus that wasn't covered by the existing alarm system and the structures that we had in place for that alarm system.
Although the hospital operated traditional security systems that provided coverage in building areas and courtyards, it didn't fully encompass the open spaces of the campus.
It was incredibly apparent that we needed to provide better coverage, better safety, not only for our staff, but for our patients who also move about the campus.
This was an extremely complex solution involving a lot of different partners and stakeholders.
The solution was the personal duress alarm system, which we call PDAS, that uses RFID technology.
Radio frequency identification, RFID, is typically used for tracking things like vehicles and products. A small tag containing a computer chip and transmitter is placed on the item, and a reader device communicates information about it wirelessly. Using this same technology, the team at the Napa Hospital campus developed an innovative personal duress system that uses an electronic device that staff wears on a lanyard at all times.
So we all wear them everywhere we are on the hospital campus. When you pull on this, the dispatch and police are notified. It'll vibrate, it'll give an audible tone, and then the lights on it will start to flash. And then it actually has a display where it starts to give me the exact room and the last name of the person that actuated their tag.
The RFID that we're using here is a bit different as well because we're using two-way communication and real-time location of employees.
But it's like wearing a little computer. It receives information as well. So the first responders are actually your coworkers. They receive that an alarm has been triggered on their tag, and then it actually gives them instructions on how to find the person who has triggered the alarm.
Easily, we could not have done this by ourselves, and we were very fortunate to have amazing collaboration throughout the project.
This collaboration, we worked with a lot of different partners for the hardware, for the installation, and also the software development.
This public-private partnership became an essential part of an undertaking that encompassed numerous existing and complex systems. Business partners, including Cisco and Ekahau, made vital components of the solution possible, including building on an existing voice-over IP infrastructure and integrating an expansive wireless network.
Staff feel much safer at work today due to the successful deployment of PDAS. This was much more than an IT project. This was a project that was for and about people. It is a project that was born from a very tragic circumstance, the loss of an employee, and it is a project that is all about improving safety for our staff and for the patients that receive treatment here.
As this unique RFID solution is rolled out to other state hospitals, we may begin to see this technology replicated for other environments where safety is a priority, including mental health facilities and even prisons. Whatever the setting, AT&T is available to help make it happen.
While this is a business issue, but the issue here is actually safety and saving lives. So that makes it much more important to us.
So it really is an amazing example of people coming together with a common goal of improving safety and remaining dedicated to that end.